Hello everyone, welcome back to Politics Relaxed. Today we're going to be talking about kind of the reopening. We've just seen it happen today, and also, of course, yesterday I should say, there was a bit of a scandal, maybe you'd call it, of Boris Johnson and Rishi Sunak trying to avoid isolation by using a government scheme. Or I say trying to use, that's up to interpretation later, but we'll get onto it in a bit. First of all, obviously, welcome to Freedom Day, everybody. How are you all feeling about the restrictions?
Delighted. I think I'm feeling very happy, to be honest. Obviously, the situation is difficult at the moment. We know that we've got a high case rate. We know that the infection rate is rising as well. But at the same time, we know that the vaccination rollout has been so successful. And basically, it's summer holidays, young people aren't in school, so that's going to reduce that transmission. And also the fact that obviously in the winter, we're going to have a situation where because it's respiratory disease, we know that it will transmit much easier. So this is, I think the right time. I know that there's been bits of debate about certain things like masks and all that, but I think, to be honest, the majority of the public will continue to wear masks in lots of areas where they have done previously. I think it's just taking away from the kind of reality of a kind of dystopian age where the government are telling you to do something and you have to do it. So I think people will actually feel socially responsible on this, and they'll wear masks in crowded areas and that kind of thing. But yeah, I mean, obviously that's the big sticking point. From what I can see in terms of like future restrictions, what the scientists like Chris Whitty have been saying in previous press conferences is that now we've got to the point where we're in a situation that the vaccine rollout has been so successful and such high proportions of over 18s are vaccinated. So I think above 90% double jabs in, above 70% single jab now. There comes a point where restrictions will simply only delay hospitalizations and deaths. You're shaking your head, are you? Because this is exactly what Chris Whitty said. This is exactly what Chris Whitty said.
Do you know what Chris Whitty also said? Chris Whitty also said that deaths in a few weeks could get to a very dangerous level. That's not a direct quote. I don't have the quote in front of me, but I'll find it.
Well, what I just read out is a direct quote. So yes, they may reach a horrible level. The fact is that has been accounted for in the original modelling for the roadmap, and currently, despite the high case rates, it appears as though it's within the margins of what was expected. So I think, yeah, have you got the direct quote?
I have. Chris Whitty, hospital numbers could hit scary numbers, quotations, soon.
Yeah, that's undeniable. Yeah, I'm totally going to accept that. But if you have further, but they're both, the two things can work in correlation.
No, but this is
so yes, they will hit scary numbers, but the restrictions will simply only delay those scary numbers to the winter, when it'll be even worse because we've got flu and the NHS will be overwhelmed. That is what he said. Obviously, that is perhaps what he intended to say. That his direct quote was that, if I get it up, there comes a point so far into the vaccination rollout when restrictions will simply delay hospitalizations and deaths. And the fact is that we've reached that point. So yes, I think some of the finer details, I think it's right that there's debate about, like masks, should they be mandatory, should they not? But I do think that now is the right time for us to have a wider reopening.
See, here's my big problem with this reopening. It's rhetoric over science. It's let's have freedom instead of listening to the science and saying what's right. I think if you saw the other day, I think it was like hundreds of medical professionals, scientists signed a letter saying this was dangerous. I again don't have the letter in front of me. I'll get it in a second. But I mean, it was published in the Lancet a few weeks ago. This could be really worrying. And people are saying we could hit 200,000 deaths, even if we've weakened that that a link between hospitalizations and cases, 200,000 is going to have a significant impact on hospitalization. And as Chris Whitty says, it could get to scary levels. We don't want it to get to scary levels. We want to protect our NHS.
Well,
It's more
one thing
about
I
this
would say in
freedom.
response to that is that, having watched the press conference in the last hour, Sir Patrick Vallance actually said in that he thought it was fairly unlikely that deaths would reach over 100 a day. Now, my personal view is that over 100 deaths a day would be a worrying level, but under that, I think is sustainable at the point we're at.
No, of course, but I just don't see why there are like these simple measures such as mask wearing, such as social distancing when we're in big spaces, such as like just a few of these things. And then the other big point to mention is the pingdemic, it's being called, although I would hastily use that because I think it like pushes people to delete the NHS app, which we don't want to happen. But over 1 million people last week were self-isolating. We have to look into this isolation policy because people are going to be on statutory sick pay. That for a lot of people might not be enough to survive on each week. That is hitting the poorest in society. Then, of course, the economic effect of that. If there are 1 million people who can't contribute to the economy, can't go out and spend money on the high street, which we really need at this time, this is a big problem. So maybe in a sense, although a lot of people have said it's going to be good for the economy that we're opening up even more, maybe if we were a bit more conservative with our measures, we might actually see an improvement in the economy than what we would with more because of this pandemic, because people are being pinged by the NHS app. Millions of people are going to be isolating. Boris Johnson himself is isolating on Freedom Day. On Freedom Day, when everyone's meant to be going outside and having a great time. But no, Boris Johnson's sitting inside along with 1 million other people.
The thing to remember is that this is going to be a very difficult 4 weeks up until the 16th of August, when we're going to have
Why make it difficult? Why make it difficult? Because because of this notion of freedom instead of a notion of science, which we should be going on. It's going to be difficult. So how about we just slow it down a little bit and be sensible?
Well, firstly, it appears as though the advice that the government are acting off is the advice of their chief scientific advisor and their chief medical officer, who have stood up on the podium, and they have been fairly clear, I think, that at the end of the day, if we carry on with restrictions at this point, all we're going to be doing is delaying hospitalizations and deaths. And the fact is that restrictions do have a lot of negative effects on people's lives. It's not just some kind of fanciful notion of freedom. We know that people commit suicide because of lockdown.
Hang on. Hang on. You should not be doing that. You, actually, if you look at the Samaritan advice on press, you should not be attributing suicide to a certain thing. So why are you saying that? Like, again, it's more rhetoric over science. Let's use the advice of the Samaritans, a suicide charity, and not.
Well, I think you'll find the Samaritans are not scientists. The Samaritans
I know
are a charity.
I know that. I know that.
And
but they are experts.
Well, yeah, of course. But I think the thing that you've got to remember is that this lockdown and the restrictions we've had do have very negative effects on people's lives. But I take your point, absolutely.
What? No. But what is wearing a mask on a tube gonna make is that gonna make a significant impact on people's lives? I don't think so.
Well, I think actually, it's still mandated that you've got to wear a mask on tubes. So
yeah, and that's positive that they've done that. But again, another thing is going to a nightclub with hundreds of other people or not. Is that going to have a significant impact? Of course, it's great that everybody can go out and celebrate. But it's better that we save lives and get the hospitals to make sure that we have enough people staffing hospitals and make sure that there are enough beds.
I think the real thing it comes down to actually is vaccinating young people now. So when it comes to nightclubs, I think it's great that they're reopening. And I think that's important because they have suffered more than any other industry. They've literally been shut for 1.5 years, which is shocking. And what we know is that the uptake among young people is much less significant than in the older generations. So far, obviously, everyone over 18 has been offered the first dose. I believe it's only 38% of people in the youngest category have taken up the offer. And we really need to we really need to encourage people. Like, for example, what the PM announced today was that nightclubs from a certain date will have to only accept people who have been fully vaccinated in, and that will hopefully give young people the incentive to get the vaccine.
I know electronic dance music is very close to your heart, but it's also important that we look at if we look at the Netherlands, they opened up in the last few weeks, and the PM their head of state has had to come out and apologise. So we have to take this with a pinch of salt. The key thing I'd refer you to is the Lancet published a signed letter from over 100 experts saying mass infection is not an option. I would highly recommend everybody watching this goes and reads that.
Of course, mass infection is not an option.
In late February, when Boris Johnson opening up, he said that the opening up would be about data, not dates. But we've gone from 2,000 cases to 50,000 in about a month and a half. And I think everybody can clearly see that this is not data. This is this is trying to
rhetoric.
Get into rhetoric. These could the more cases you get, the more variants that pop up, and these could be vaccine repellent, and we'll be back to square one. I think this government will be done if there's another lockdown. They have to put billions of more pounds into furlough, which they don't want to do. They want to open up the economy, and I think for the time being we'll have to keep something shut and keep some restrictions here before we open everything up. I think keep support for nightclubs, keep masks mandatory. I don't think it's the right thing to do.
Yeah,
I think it's good that we've had masks required and mandated in enclosed spaces. I think that's important. I think what we look at the Conservatives, and what does it actually mean to be conservative? It means to proceed with caution. And unfortunately, I don't really see that. I mean, just labeling Freedom Day as Freedom Day, it sends a message that everything, we can go on the loose, we can go out and do everything we want. And I think we have to be cautious. And I think just opening back with small measures, and then managing it, and then using the data. See, right, if we've opened one measure, right, in the first week, look at the data. Has it improved? Has vaccines, what is the vaccine effect on cases, and how does the vaccines, cases, and reopening, how does those three things link? If there's a good link, then we proceed further, go on to week 2, progress then, and then progress until. I do get Cameron's point by saying, if we don't do this now, we will by winter there will be in the mud. We in the winter, the NHS, we overwhelmed. It will all go wrong. So it's about finding that right timing. Is now the right time? Yes, but we maybe could have delayed it. Not delayed it, just delayed the reopening by a few weeks. Now probably is the right time, but not as fast as we're doing it right now. So
the one thing I just respond to is to say that Freedom Day is definitely not a used government term. I haven't seen anyone. I haven't seen any minister describe it as Freedom Day.
He called it like something else.
That's been very much invented
it was
by
Churchillian
the press.
Day, I think. Churchillian Day.
Oh, he called it something, that's for sure. Like
Who?
I forgot what it was. Boris called it, like, it wasn't Freedom Day. It was I forgot what it was now. He called it something. Anyway, that wasn't probably the best.
Churchillian, I'm pretty sure.
Yeah, exactly. Anyway, let's move on, because the next big story of the weekend was, of course, Rishi Sunak. It started with Sajid Javid getting COVID, and then Sunak and Johnson were both pinged by the app, but they were mysteriously allowed into this trial, which I have not heard of like that much before, because I was a little bit confused at first. I've looked into it more, and basically we don't know that much about it. Because Border Force were originally meant to be part of this, but have said not that many people took it up. And Royal Mail were meant to be part of this, but according to their spokesperson, this isn't a thing that Royal Mail are part of. So I'm just very, very, very vague. I think the details are on this plan. And I would really like it, to be honest, if Sajid Javid would come and address the House of Commons, maybe have some urgent questions, because I think it is important that the public and MPs know what this scheme is, because I don't think we have that many details on it as of yet.
That's not going to happen anytime soon because he's stuck at home.
Yeah, no, of course, but he can zoom in, can't he? He can zoom in. I'll send a junior minister.
I'm not sure actually when you're kind of the subject of an event. Say it was Prime Minister at PMQs. I'm not sure that they can do it from home.
Oh, really?
Actually.
Oh,
yeah.
Fair.
Anyway, I get you. I take your point. I take your point.
Yeah.
No,
well, it's just very, very confusing, and it's obviously Sorry, I'll go to you in just a second. It's obviously dented public confidence. The polling. I don't have it in front of me. Again, I will get it in a second, like I always do. A bit disorganized of me, but the polling is not looking particularly great for the government. Here we go. Snap poll, majority say the PM's plan to dodge self-isolation was unfair, 60%, 33% think it was fair, 60% unfair, 7% undecided. So there are a lot, and all of these polling are very damaging. Even Conservative voters damaging 53%, not damaging 40%. All voters 63% think it was damaging, 29% think it was not damaging. Saying the story itself will not be damaging. So it's obviously going to damage the government reputation. And it's just kind of a long line of events, the Hancock story, the Barnard Castle Cummings story, and then this. It just leads to this idea of us and them. And it's one rule for us, another rule for them. And that's what it feels like to me. I know they rectified the decision, and I'm happy that there was a U-turn. But the fact is, we still know very little about this program, and it has dented public confidence. And I think those are the key two main points I would make. Rajan.
Yeah, if we didn't have the Dominic Cummings, Matt Hancock incident, then we might be looking a more lenient standpoint for this week with the situation regarding the new pilot program. I think the pilot program is good. Yeah, you do agree as well. But I think the manner in which it's been presented by the government, because we had Robert Jenrick coming on the news round today, and he said he doesn't know how 10 Downing Street were put on the list, and I think that's worrying. That is very worrying.
Even as a standalone story, it would be dangerous for the government, and I think it dents public confidence. That's for sure.
And also,
no one knows
the TFL as well. They said the TFL's on the scheme, but they've not heard anything of it. I think that's very worrying. Yeah, Cameron.
Sorry, yeah, TFL, not Royal Mail before. Just to correct myself.
Well, I think I would have. I think that they made the wrong decision initially, and I would have done things differently without a doubt. I think they should have realised that you measure the public mood, and even if you are enrolled on a scheme like that, if you are literally running the country and you have hundreds of thousands of people being pinged every day to self-isolate, and you get pinged and you don't, obviously that's a very bad look. I'm not convinced by your arguments about the pilot scheme, because I don't think that either an argument for it being valid or it being invalid has really enough substance to it. So I agree that we need to be able to learn more about it. But from what I can see, from what is visible, gov.uk, it was rolled out in March, and it has 40,000 employees enrolled on it.
This is the thing. That's incorrect. Because I've got this Guardian article up.
It was May, I think, the first report from gov.uk.
From Jenrick. No, sorry, not from Jenrick. Where is it? No, I can't find this quote now.
Well, what I read to you was from gov.uk, so that's what the government are telling us about it. Now, whether you believe that's valid or not, then that's a matter of personal opinion. But I can understand why you have suspicions about it.
It's not a matter of personal opinion, because Downing Street insists, from the Guardian article, it is totally separate from another project, the Daily Contact Testing Study, which you're referring to, which was set up in May and splits participants into random two groups. One cohort is control test and another has to self-isolate, and numbering up to 40,000 people where the pilot was established. So that's a different thing. to this government.
That's very confusing then,
Downing
because
Street.
the link that I got on an article I was reading, I think it was on the Independent, was to that particular pilot on gov.uk. So I think this might exemplify the confusion that you're talking about then,
Exactly.
because clearly none of us actually know which pilot we're talking about. Maybe the Downing Street are talking about one, and gov.uk and the Independent are talking about another one. But yeah, so I think it's important that we can try and learn more about it.
Urgent question. As soon as Sajid gets out of COVID, or can you not send like a
one of his
minister?
junior ministers?
Yeah.
They've all been pinged in the pingdemic, haven't they? Though all of every other person in the country, everybody's been pinged. I mean, this is exactly the problem with opening up too quickly. And I think another thing to add is it really rubs salt into the wound for the nurses and the doctors who are having to isolate at the minute instead of helping out on like wards and helping their patients. That must be very hard for them, and people at the lowest in society, or the lowest paid, in society, who are on statutory sick pay, which sometimes is not even going to be enough to survive, especially if you're in a family and you're trying to support that family. It's very important that we keep mentioning this pandemic, and that's where the salt rubs in for me. It's those people who are going to be affected by like isolation, the millions of people that are going to be affected by isolation over the next 3 weeks, and that's what was really bad for me. And of course, the shadiness around this scheme, it really exemplified this government throughout the pandemic. Shady back dealings and like lack of public confidence, and that's what we've seen multiple times. This is not the first time something like this has happened, and I think it's key that we learn more about this scheme that the government was supposedly enrolled on. And apparently, according to some reports, they've now left the scheme and are not partaking in it anymore. But do we? Nobody knows what this scheme is, which is the worrying part.
Well, the thing is, if some individuals from a certain organisation enrolled in the scheme, then decide to opt out, I guess that perhaps sends a message to the entire department saying, actually, perhaps we shouldn't do this.
Yeah.
But yeah.
I mean, it's just the shadiness. There's not even that much to comment on. It's just this was definitely wrong. Good that the government finally rectified it, like we've seen many a time in this pandemic, mistake and then like a U-turn. Sometimes that results in a better decision. This time, thankfully, it has. But it really does lose public confidence and public trust, which is probably, this could be possibly the worst time to lose it, when we're opening up again, and when it's the onus becomes less so on the the rules and more on the people themselves to regulate and to have these COVID regulations. So it's really important there is public trust in the government and the public health messaging.
They need to tighten up a bit, really. I think we've seen too many times errors in communication, and from my point of view, I think whether it's the decision making or the way that the communication is being put to public in the press, I think Downing Street need to get their act together. Whoever's in charge of making the decisions, and whether on policy or just tiny, well, not tiny, but issues like this, they need to really tighten up on it, because otherwise they are going to lose the public confidence and indeed my confidence very quickly. And that's something that I'm sure they don't want to do.
They've already lost it a lot of months ago.
Well, not according to the polls.
Well,
polling. Let's pull out that great quote. Polling is a 20th century myth, or 20th century instrument in a 21st century world, isn't it, Brian?
Polling doesn't represent the whole.
Oh, no. We're not getting into that now. Thank you, everybody.
I think everyone agrees. Yeah.
Thank you, everybody, for coming. Thank you for listening. Subscribe, like. We should have a few interviews coming up, which is exciting.